This is part of a new approach to healthcare that's more patient and family-friendly and more experience-oriented. Okay? You design facilities to create a better patient experience. You design facilities that have better staff experience. It leads to overall satisfaction. It leads to better health outcomes. We'll talk more about that in a minute. And hospitals are already jumping on the bandwagon, putting this green messaging out there. Here's Providence Health and Services with their nation's greenest hospital claim. They got the first gold LEED certification from the Green Building Council. Here's Boulder Community Hospital, which has gotten a ton of attention for its green initiatives. They're LEED certified as well, but they don't tell you whether it's gold or silver or whatever. There are different levels of LEED certification. One of the magazines I read, Healthcare Marketing Report, had a big article on green within the healthcare industry in their November 2008 issue. In fact, I called Richard Cohen in October and said, Richard, I'd like to write a story for you on green marketing in healthcare. And he said, Dan, I just wrote it. I said, thanks, Richard. And it came out in the next issue. This creating a healthy and safe environment for patients, you know, you guys know the patient safety story. We don't tolerate unsafe hospitals anymore. Hospital-acquired conditions such as infections and falls, it's just not tolerated. And when hospitals make a mistake, they're picking up the bill for it now. It's coming out of our pockets. We don't tolerate injuries to staff, and design of facilities can have a huge impact on staff safety and health and well-being. Things like natural light, you know, lead to happier, healthier, more attentive staff, less mistakes happen. Small thing, but big outcomes. We don't subject patients to noisy, confusing environments that increase stress. When we're building new hospital facilities, I heard this yesterday in both of the presentations I went to, you know, we build facilities that are designed to limit stress on patients and our staff. And we need to embrace the clear connection between well-designed healing environments and improved healthcare safety and quality for patients, family, and staff. There is a definite connection, and I'll show you some places you can go to get studies. NACRI, which is what, the National Association of Children's Hospitals and whatever, they've done studies that they have published, and they show that there is a strong connection there. It's empirical evidence. So the healthy hospital movement is what I'd like you to leave with today and think about, and pitch to journalists and get your hospital in the news for the things you're doing. One of the elements is smoke-free. How many of your hospitals are smoke-free? Yeah, almost everybody's gone smoke-free. You're creating a healthy environment for patients, for staff, and so on. You should. I mean, hospitals should have been the first to go smoke-free before any other businesses. There are lots of resources online to talk about why going smoke-free is important. Recycling programs. How many of you have recycling programs in your hospital? You ought to, because the amount of stuff coming out of there is immense, and if you can help initiate recycling programs, it would be huge. It's amazing. 6,600 tons of waste per day. And then when you multiply that by the cost of $44, say, using the bottom per ton, you know, that's, I don't know, I don't do math, but it's a lot of money. So just the cost alone, being green does not mean it's expensive. You can actually save costs in terms of through recycling, through employee health, through better patient outcomes. You can actually save money for your hospital by adopting these. Green building design is one of the things people think of first and foremost, I think, when they think of being green, probably that and recycling. And in healthcare, we've been very slow to build actually green and LEED certified buildings, but it's really important. And as I mentioned, NACRI, together with the Center for Health Design, which is a great resource if you're thinking about building green medical office buildings or other facilities as part of your health campus, they've done research together that empirically proves the positive outcomes that come from intentional design like this. So healthy building design leads to improved patient safety, improved clinical outcomes, improved psychosocial outcomes, increased patient satisfaction, increased staff effectiveness in providing care because they're more alert, they're happier, they're healthier, increased staff satisfaction, and improvements in staff health. A lot of those things are things that are going to save you money and make you a better hospital. Healthy building design. I saw this same slide in 2 presentations yesterday here. I mean, it's essentially the same things. The building of single patient rooms, adequate space for families to spend the night in the rooms, access to natural areas, where you can get off and have quiet and reflect, ample natural light, and allowing patients and their families to adjust the environment in the rooms and have control of that. Artwork on the walls. I mean, did you guys see any of this in presentations yesterday? This is all part of that healthy hospital movement. And I want you to have that context to take it forward after today. Reduction of high light levels, access to hand washing stations. People, your staff are going to be more likely to wash their hands if it's easy to get the hand hygiene dispensers and to sink. So when they're designing rooms today, they make it easy for when the physician or the nurse walk in the room to get right to the sink to wash their hands. The dispenser's right there outside the door of the patient's room. So it's foolproof. And if you make it easy, they're much more likely to use hand hygiene dispensers. Music therapy, things like HEPA filtration systems in hospitals. Putting the supplies closer to the patient so the staff isn't having to lug supplies all the way around the hospital. It leads to less staff injuries. Circadian lighting, you guys know what circadian lighting is? It's where the lighting adjusts within the hospital. So the lighting at night is dimmer and it reflects the change in nature. It sort of brings nature into the hospital and with the lighting. So that it's not this sterile, bright light 24 hours a day. You can get a sense of the outside world. Use of booms. Have any of you got booms now in patient rooms instead of the head walls behind the bed? You have them in your new bed tower. It's remarkable. They're pneumatic booms, so the nursing staff doesn't have to be lifting and hauling stuff. It's really easy to move around the bed. It's a terrific move for nurses in particular. It eliminates back injuries. It's really good. Healthy food programs. How many of you have healthy food or nutrition programs within your hospital? For staff and for patients. It has been shown that lifetime obesity-related medical costs increases, body mass index increases. It's just a fact. And the healthier you can make your staff, the more you can introduce them to these healthy habits, bring good food, fresh food into the cafeterias, the better off you're going to be. It's going to save you money as a hospital. Worksite health promotion and disease management programs can yield positive clinical and cost outcomes, including a decrease in health plan costs, sick leave, and workers' compensation and disability costs. It's a very good thing. If you don't have a healthy food program in your hospital, you ought to talk to people and try to initiate it. Give your staff some healthy options. Mark's going to talk about the healthy food program they have at Lexington Medical Center. Some hospitals are actually having, and I love this, farmers markets on the property. So your staff during their break or at lunch can go out and buy fresh produce that they can take home with them and encourage healthy habits, not just while they're eating at the hospital, but take that home with them. It's a fabulous thing. Not everybody can do it, but a lot of people are doing it already. So the opportunity for you all as marketers is to communicate to your different constituents about the healthy things you're doing and to initiate healthy habits if you haven't initiated them already. It's a great opportunity, and Mark's going to come up and actually talk about the things Lexington Medical Center is doing in terms of green practices, but more importantly, how they're marketing them to their core audiences. And there are really 2 core audiences that they're marketing to. One is the external world, and one is their internal audience. And you can't underestimate the importance of the internal audience.